Hi, thank you so much for stopping by our poster. On behalf of my co-authors, as listed above, we're thrilled to share with you our experience in developing the State of Connecticut EMS-C transfer guideline to be used by community hospital providers. This is the development of this tool, and we're excited for our next steps, which I'll get to at the end of this talk. For context, transferring children from the community hospital to the children's hospital is a common occurrence, and that transferring between two provider teams, as we all know, can be a high-risk, complex healthcare event with issues surrounding communication, family logistics, travel safety, and indeed cost. So as such, Connecticut EMS-C and a significant number of partners aim to develop a series of tools to facilitate safe and effective pediatric transfers and standardized practice across the state. This effort addressed Performance Measure EMS-C 6. The methods to complete this project went as follows. Connecticut has 2 pediatric emergency departments and 34 community emergency departments. We're lucky that no community hospital is more than 3 hours from one of the 2 pediatric centers by ground transport. Historically, Yale New Haven Children's Hospital and Connecticut Children's had independent guidelines for transfers. The iterative process to developing our tools is as follows. The first was most important. We had to assemble our stakeholders, and we had representatives from Connecticut EMS-C, Yale, Connecticut Children's, Connecticut branch of ENA and the American Academy of Pediatrics, from ASAP, from our Family Advisory Network, and from some really exceptional PECs as featured in the author list. Step 1, we wanted to develop a mutually agreed upon criteria warranting pediatric transfer. Step 2, we arranged these criteria by level of acuity. Thereafter, we discussed the safest and most expeditious transfer modality. We wanted to ensure that the patient and their family needs were considered, and as such, we developed a readiness transfer checklist. Finally, we brought our ideas to a graphic organizer to make visually appealing tools. The final products, as outlined below, is a big poster to be placed near one would find an EMTALA form or other transfer-related documentation, and this is really to help frontline providers make decisions around should the child be transported, and if so, by what modality. Secondarily, at the bottom of the poster, one sees the most common areas for referral in our state. There are also less common hospitals that receive transfers from the state of Connecticut, and they're listed on the right side. The second product is this pediatric transfer checklist, and this ensures that the community hospital provider sits down with the parents and really goes through the why and how and where their child is going. Again, addressing those family logistics that are often overlooked with pediatric transfers. So our tools aim to help ED providers apply pediatric transfer medicine best practices throughout our state. We hope that in our next steps we'll be able to collaborate with community EDs to make sure that they're both implementing, utilizing, and making sure that the patients are cared for and transferred with standardization and safety in mind. Qualitative interviews of transferred pediatric families and the Family Advisory Network may add further data to consider so that we all learn about pediatric transfers in our state. We're thrilled to collaborate with anyone in EMS-C network or anyone who's interested in transfer medicine about this project, and we look forward to hearing from you. Our contact information is found below. Thank you.